We've been spending some time talking about the genetic foundations of child development and ways that the child develops in the womb prior to its birth. So what we're going to do now is we're going to look at some ways that development can be impacted while the child is still in the womb. And so it's important to keep in mind that the prenatal period is probably one of the most important periods of growth because any type of disruption or problems that occur in the womb are going to have lasting effects on the child long after he or she is born. So we're going to spend a couple days looking at some different kinds of things that could potentially happen to a child and why it's important to really be careful and cautious during that period of pregnancy. So the first thing we're going to talk about is something called teratogens. And so teratogens are basically any kind of environmental agent that causes damage during the prenatal period. So there are all different kinds of teratogens, and we're going to talk about what some of those are. Basically, this word comes from a Greek word called teres, and teres means malformation or monstrosity. So from that you can conclude that exposure to teratogens often can cause some sort of anomaly or malformation of the child. So why are they dangerous? Basically, they're mostly dangerous because they can directly cross through the placenta to impact the child. So as you learned in the womb video, the placenta is really meant to protect the baby from exposure to things that are dangerous. There are certain kinds of things in the environment that can get through the placenta and have an impact on the child. And some things like radiation will just directly impact the fetus. And so all of these things can have some sort of negative impact. So the big thing to note is that exposure to a teratogen can cause or increase chances of some sort of defect, either physical or cognitive. Typically 80% of the birth defects that are out there are caused by environmental factors. And so as I mentioned before, the placenta and the amniotic fluid, which is inside, help to keep out those harmful substances, but there are certain things that they just can't block out, and so they get through the placenta and then they can enter the baby's bloodstream, which will cause these impacts to happen. So there are four major factors associated with how much impact a teratogen can have on a baby. So the first of these is dose or level of exposure. So this means how much exposure the child is getting to this teratogen. So the larger the dose over a longer period of time, the more negative the impact will be. The second one is heredity, and basically a person's genetic makeup is important because some people are better able to withstand harmful environments or harmful exposure to harmful things. So that does play a role, although it's kind of more difficult to determine exactly whether or not it's going to have the greatest impact on whether or not a teratogen has more of an impact. And the third is other negative influences. So these are things like being exposed to multiple teratogens. So if you're exposed to household agents that are dangerous, you have parents that smoke and drink, those could be combined to have lots of more severe negative outcomes. Other negative factors that could influence how much of an impact a teratogen has is prenatal care for the mother, lack of medical care, poor nutrition, all of those kinds of things. And then the fourth factor is the age of the fetus. So the time of exposure and whether or not that exposure occurs during a critical period of time will determine how much of an impact the teratogen can have. So to sort of illustrate that last one, we're going to take a look at this chart, which you also have on your note sheet. And you can see that there are different critical periods of development. So the areas in red represent periods that are especially sensitive to exposure to a teratogen. So at any point in time, if a child is exposed to certain teratogens from weeks 3 through 16, that could have a very negative impact on the development of these different parts. So for instance, the central nervous system, you'll notice, has a much longer time span where exposure can be very negative. Whereas some of the other ones, like your upper limbs or your lower limbs, those have a much shorter window of exposure. So areas in red mean there's going to be major anomalies, so major malformations or major dysfunction. Areas in yellow mean it could just be more of a functional defect, or it could be more of a minor problem. But nonetheless, major or minor, there still could be impacts on the child. Okay, so we're going to look at 6 major categories of teratogens in class. So the first is prescription and non-prescription drugs. Second is illegal drugs. Third is tobacco. Fourth is alcohol. Fifth is environmental pollution and radiation. And sixth is infectious disease. So you're going to work in groups of 2 or 3, and you're going to be asked to read a little bit about this particular type of teratogen, describe what is included in the category, and then explain briefly how exposure to that specific teratogen could potentially impact the fetus and what types of long-term effects it could have for the child. So I'm going to show you your groups and what your topics will be. So group 1 is going to be Grace, Paige, Rossi, and Lauren, and you guys are going to be exploring legal and illegal drugs. And these are the resources that you will review. I'll post these on the wiki so you can get to them. Tobacco is going to be Asteria, Jamie, and Sydney. Infectious disease is going to be Taylor, Jasmine Aday, and Markella. Radiation will be Jasmine White, Paige Allred, and Carly. Environmental pollution and household agents will be Ned, Kayla Stottlemyre, and Casey. And then caffeine will be Sarah and Kayla Smith. So be prepared to come into class tomorrow and we will get started exploring these different kinds of teratogens.